Hello and welcome to our next episode of Coffee and Conversation AI in Healthcare. Today we have a very special guest, Dr. Stefan Boutillier, specialist in public health medicine with a special interest in clinical informatics, social media, and digital health. You're also an author, tutor, and digital health consultant focused on creating transformative and effective change. Hi, Stefan. If you can tell us more about yourself.
Yes, Michał. So it's really
Hi.
a pleasure to be here, to be one of the voices of artificial intelligence in healthcare. By no means I'm an expert, but I think I've started the journey. And just to give you an idea of what I do, when people ask me what is public health, and I've written actually about this publicly as well.
Mhm.
People ask me like, but like, aren't doctors like only like one-to-one? You know, are you in a clinic? Are you a GP?
Yeah.
And thanks to COVID, things got a bit easier to explain. But what I like to tell them is that I'm not a doctor of one person. I'm not a doctor of just 1,000 persons, but I'm a doctor of more than 100,000 at a time. Like this, with this population approach. So I am thinking, how will a specific intervention, be it good, be it bad, how will it impact a population? And
Mhm.
what can we do to minimize the impact or improve the outcome, the health outcome of a specific intervention? And this applies for digital health, it applies for artificial intelligence, it applies for many different things. And this is the interesting aspect that is evolving. Like, how are we bringing all of this together? And it's all innovative, all new, fresh, and we're trying to figure that out as we go along a bit. So that's kind of my journey so far. So, I'm a medical doctor by training. So that's my background. And I decided to specialize in public health because, as I told you before, Michał, I'm not really a big fan of night shifts. So I said, okay,
Right.
let me go down this route. But really and truly, it is not this challenge that really pushed me down, but it's the fact
Mhm.
you can have an impact on thousands, if not hundreds of thousands, and if not at a bigger picture, millions of people. So if you have a role, for example, in strategizing the direction of healthcare or public health or health within the next 10 years, you can potentially have an impact on the policies affecting millions of people. So I think there is a really big opportunity there to, make a really lasting impact. I like that.
Thank you, and thank you for explaining what is public health. And I think what you said, like the COVID-19 pandemic, like truly gave all of us, all people, like better understanding about how important the public health is and how important is making decisions on this on the level of nations and continents in regards to vaccinations or the next steps on what need to be done to maybe not stop but to slow down the pandemic back then. And also, like mentioning the COVID-19 pandemic, it was not only a great public health challenge, but also challenge for healthcare and a true digital health explosion and transformation of the healthcare space. I like to say it gave us of course a lot of tears, fear, and there were a lot of horrible things happening, but also to the healthcare space it gave us like it helped to speed up the whole process of transformation by 10 or 15 years, if not even more, helping us to all to grow. um, but wanted to returning to the topic of the public health then, because for me it's super interesting, and I think for our viewers who will be listening to this blog will be also super interesting to hear and to learn. Does public health use any application of AI today, or maybe you can see how AI could streamline your work in the future if it's not used nowadays? Because I think this topic, from the perspective of the public health specialist and the public health and the connection with AI, is not that much touched and discussed.
So I think Michał, first of all, if you do a simple literature research or literature review, you already will get some insight into what's happening on artificial intelligence in public health. So this is not a new topic, completely new topic, or something that has not been explored yet. We have papers, going way back to, let's say way back, because
Mm-hmm.
now I think we're really witnessing the age of AI. Even Bill Gates talked about this actually very recently. And if you look at 2018, 2019, 2020, we already start seeing like people trying to analyze what's happening in artificial intelligence in public health, specifically in public health. And most of it revolves along with it revolves around the basis of artificial intelligence, and that is data science. So
Mm-hmm.
data science, as you know, it's also a field which was growing in parallel with artificial intelligence. Of course, these fields have been way way back with us. Artificial intelligence, we're talking about 50s and 60s, so this is not something completely new. And we've already started seeing sometimes there were things that were called artificial intelligence back then, but now they're completely normal. They're not really artificial intelligence in today, but now, because the field is evolving so quickly, we're seeing new applications. And I've so far, most of the things that I've seen are in disease surveillance, for
Mm-hmm.
example. So using artificial intelligence to predict the location of the next outbreak based not only on health indicators, but even on environment, temperature. All these different things have an impact on how disease spreads and how disease evolves. Even, for example, very recently, I've seen significant efforts being done by hospitals worldwide, such as Mayo Clinic. For example, Mayo Clinic now,
Mm-hmm.
they are introducing the idea of using artificial intelligence, especially for social determinants of health data. That means that all employees of Mayo Clinic now, when they take their decisions, they have helper tools to enable them to take even better decisions based on, for example, the location of that patient, where that patient lives, or possibly, if you look at social determinants of health, it's not just location, but for example, it is employment, it is their family environment, it is, their, not, and when talk about environment, we're not talking, for example, about someone just, talking about just the outside environment if they're surrounded, but even the inner environment, the inside environment. How do they keep their homes? So I have all these different pieces of information which really have an impact. You can live in the most luxurious place possible,
Mm-hmm.
but then inside you don't keep it up, you don't clean your place, you just leave everything, you just throw everything in the even that, thanks to social determinants of health data, we have much better vision of how things happen. So this is happening as well, and they're bringing like this population health approach, and this is seeping in everywhere, I would say. And I think, I think the way that I see the things evolving, we have not yet a full picture of how artificial intelligence in public health is being. We don't have it yet. And this is because of the explosion of generative AI. So we have as yet to discover how individuals or public health organizations use generative AI, for example, in their grant application, in their policy decisions. How they use, for example, do they use just ChatGPT or do they use ChatGPT with plugins? Even just recently, for example, I was at a data science summer school because I really want to immerse into the topic. And I
Mm-hmm.
was using ChatGPT to help me answer some of the questions during the school. And yes, you might say,
Awesome.
isn't that cheating? No, because I used the ChatGPT, I had to use a special feature called Code Interpreter. I pay, for example, the monthly subscription, and then there'll be some people who might criticize me that I'm going down using ChatGPT. But up till now,
Yeah.
unfortunately, let's say, it was the easiest way for me to get access to these tools. In order to get access
Mm-hmm.
to generative AI tools that are open source, I need to download, I need to still do a couple of steps to get there. But I will work on it. I promise. There are some couple of people who will for sure listen to this podcast, and there I need to do some effort. But but we still haven't even measured that, and there will be some impact. But the good thing is that now we are we're in a position that in public health, for example, even when we look at health promotion, even when we look, at policy making, strategizing, all of these things will come together. So we already do a lot of work, but imagine being supported by generative AI tools, simple
Mm-hmm.
things like checklists. Because even public health organizations, sometimes they get sued for missing something out. So imagine having a document which is ready, which is developed through knowledge developed by many years, acumen, understanding of the topic, deep analysis, deep expertise. And then you complement that with generative AI, ideally highly curated one. In fact, that's the key word, curation. And when
Yeah.
you have this highly curated generative AI, which might not necessarily be fed all of Wikipedia, it could be fed, for example, the top 100 papers, for example, on a specific disease. Let's say, for example, obesity, just to come up with it one,
Mm-hmm.
for example, or the top evidence. And thanks to that, you have language learning models, which help you come to an answer. And we haven't even started yet. We haven't even gone down. And even if you just, for example, go on Databricks, the effort that they're doing, Mosaic with Databricks and Mosaic, there's Meta with their Llama model. There you have Claude, you have Claude GPT, you have all these different efforts happening in parallel to help us, give better, better outcomes, and all of these have an impact with creating really, really, really valid outcomes, better decisions. And what I like, for example, I was really impressed. So I'm seeing, for example, ChatGPT is seeing code interpreter, you're
Mm-hmm.
seeing the actual, writing aspect. You're seeing plugins. But now, for example, just behind me right now, for example, we were talking about this
Yeah.
before. 4 minutes before the call started, I said, okay, let me go on mid journey. I say artificial intelligence in public health, comma, and good background for an online call. And this came up. And then I said, but I want to go even deeper into the topic. And I said, okay, zoom out 1.5. And I really love it because I really love this option because there is a lot of work being done in the background. So, back there. And
Mm-hmm.
then what on the outside, there is what is really happening, what is practical on the ground, clinicians speaking to each other, for speaking to patients, and the patients kind of starting to figure out what is artificial intelligence is. And you have this happening in real life. I think that is one thing that really is happening. But if I had to be practical, what I'm really seeing, especially in artificial intelligence is public health, is a lot of work done, using data science techniques, using machine learning, deep learning, using like the basic statistical techniques, and building on that to build some things like prediction models, for example, to predict outcomes. And really and truly, that is what I'm seeing happening practically. And people then using those prediction models for improved policymaking, improved health promotion, evaluating and monitoring disease surveillance. So really and truly, beyond that, I haven't seen that much. But I would like to mention one thing when it comes to generative AI. For example, we in public health, we advocate for the integration of systems. That means that data from one system goes to another system because we need that information to take public health decisions, important ones sometimes.
Mm-hmm.
And something like, for example, like the top generative AI tool right now in the market, let's say, if I want to, for example, if I want to map a specific data set to an OMOP, for example, common data model, I literally can put the feeds in this tool and say how I'm gonna map this. What is the idea? How can I make sure that it's interoperable even and include SNOMED and FHIR? How can I make it? And you'll have the instructions, at least somewhere where to start from. Even something as simple as a checklist. Let's say, what are the screening criteria
That's right.
checklist? And you ask it
Mm-hmm.
and you get it. And so these are the things I think that we haven't even started measuring yet. And that's, I
Right.
think, will be definitely a long talk for another time.
Thank you for that. I love the one of the first topic that you mentioned. So the social determinants of health. So not only what we are viewing as public health, what can be measured, like blood pressure and other health parameters, but these parameters, the social ones that are really hard to measure. But with the help of AI, with the help of data science that is bringing in so many data inputs, you as a public health specialist, you will be able to help the whole public with this new informations. And in regards to ChatGPT, generative AI, I can clearly see how it can speed up the work. And as you mentioned, like what was generated in few minutes, in few seconds, that usually it would take you much more time and involvement of third persons into that. It is just amazing how it can streamline the idea creation and cross collaboration to, for example, help us people who are not designly skilled to really make a conversation with others to show up our ideas. But moving on to our main next question, um, is what kind of like challenges while implementing AI solutions like generative AI in public health can you see, or as a governmental sector, what do you think are the key challenges here?
I think when it comes to government, because this is people's money after all, and people's money
Mm-hmm.
need to be used wisely and shouldn't be used like left, right, and center. And even because of the of the need for like to make sure that each penny is used well. Most of the time,
Mm-hmm.
the biggest challenges that we're facing is procurement. So, and this happens not just in my country, but happens everywhere. These are the challenges that many governments face. And when it comes to procurement, sometimes the procurement methods that were possibly designed not for software, or were designed for other tools such as like medical devices, or they were used for specific stock, or they were used for buildings, for renting out buildings, for example, or they were used for other material, they might not be 100% designed for the
Mm-hmm.
technology. There is this big change. Now, there are countries who have figured out ways around this. For example, they've set up digital marketplace with pre-approved suppliers and transparent pricing, supported with a dashboard so that people know where the money is going. So there are options like this, but not necessarily implemented everywhere. And the challenges that we're still figuring out regulation. So there's the Artificial Intelligence Act, there's European Health Data Space regulation coming, there's even the GDPR regulation that some countries are even sometimes in mode as well. We're still sometimes
Mm-hmm.
figuring it out, or there are some parts which are not entirely clear for everyone. And these are really and truly the challenges that we'll be facing. Even there is a Data Act, and then there's a Data Governance Act coming in. So we have all this different legislation coming in. We have some which is already being underway, implemented even in the background, even though necessarily there isn't the legislation, but there is a lot of work happening in the background to make it reality. Something as simple as cross-border e-health services that I'm really
Mm-hmm.
actively involved. So there is a lot of work happening in the background. There are things going on. There is a lot of work. There is lots of literature. There is a lot of people researching the topic even. But as such, they haven't as yet translated into real life practical applications. So people are not seeing it right in front of them, especially the public health professionals. Sometimes they say, but okay, artificial intelligence, but what does it mean for me? What's in
Mm-hmm.
it for me? Kind of this idea that what's in it for me, or what will AI help me do, or what will help me achieve, sometimes it hasn't really translated into something real, something tangible that you can touch. And especially in a field like public health, where we're not working, for example, with one patient who gets better, who heals, who, has his illness sorted out, or has an operation done and he feels better and he's more comfortable and he can go back to. But in public health, most of the time, a lot of work is pretty much in the background, or it has an impact, for example, over 5 years, over 3 years. You need to be really patient in public health. I think that I know that we're not doing, direct clinical work, or we're not,
Yeah.
delivering babies, or we're not doing C-sections and, bringing joy into the world. But most of the time, what we're doing is we're writing documents, we're writing strategies, and we need to fight and chase for them to be implemented. And those don't happen overnight. So imagine artificial intelligence and public health. So you have
Yeah.
all these two combinations and they have to be done. But thanks to artificial intelligence, we can even start building, and do much more work in prediction modeling. We can do work in simulation, saying, all right, if we had to implement this model on this particular population between 16 and 25, who we can possibly even go into synthetic data generation over a period of time, how will the policy impact them? And especially if you curate really properly language learning model, or curate data sets. So it's not just about learning models, but it's about data sets as well. We have the combination of all these different things. So I think that what's really going to happen now in the next couple of years, really and truly, is there's going to be, and I hope there will be, a deep commitment to highly curated learning models, highly curated data sets, which are comprehensive, accurate, and we'll be able to build like a pathway forward. I think that's going to be a real big challenge moving forward.
Thank you, Stefan, for that. We are kind of running out of time, but I'm still having a last question to you. So maybe briefly, imagine like a world 10 years from now, and how do you imagine public health in particular, but also healthcare as a whole? If you can comment on that in few words.
So I think that in the future we will be looking at living documents. What do I mean by a living document? That means that if, for example, you're implementing a policy, you see that policy being implemented in real time. You see the living document right in front of you. So, for example, you have a vision. How is that vision being implemented right now? And you go into it and you see a knowledge graph being built around the topic. You see, actual outcomes. You see a percentage improvement happening. Or, for example, it's not happening so well. We need some effort. So what can we do? What have we learned from now? Do we need a midterm review? So I think there's going to be all these living documents happening, even in strategy, even in policy. If a policy has been decided, what is the outcome of the policy? And you see that policy outcome right in front of you. If, for example, we have an outbreak, all right, what are all the potential sources? There is connection with electronic medical records happening in real time. How are we going to, get that sorted? So you'll have, for example, when decisions are taken, instead of having just 3 public health doctors taking a decision, you'll have 1,000 public health doctors, because you'll have the knowledge graph of each public health doctor over a period of time coming together in that picture. And let's keep in mind that up to now, language learning models are very intensive. They're very resource intensive. And the way forward is really combining both language learning models and knowledge graphs. And I think that's going to be like a really big step forward, that the public health professionals evolve by developing their own personal knowledge graphs and contributing those knowledge graphs towards language learning models. We'll also be seeing, that each organization, each public health institute most probably will have their private language learning models, which help answer the tedious questions, such as, for example, how do I bring, for example, how do I buy office supplies, or how do I rent a room for 6 months, or how do I organize a meeting in that location, and you have all the steps coming up. So, or how do I for example, just kicking off, and like, can you please give me managing an outbreak checklist? And you have it right in front of you, and you take action because you make sure that you're not missing out something. Even, like helping people, helping public health professionals, making sure really and true that they don't miss anything. Because public health professionals, just like clinicians, have to make sure that they cover all the different aspects of care to make sure that there are really positive health outcomes. So if I had to summarize, living documents, the power of knowledge graphs combined with language learning models, and thinking beyond just dealing with a particular situation, but thinking beyond to ensure that no one is left behind.
Thank you, Stefan. I think we need to schedule another call to go deeper, definitely in the future of public health, knowledge graphs, and because this is super interesting. We are just running out of time, so would like to thank you again for joining us, for accepting this invitation to join our vlog series, and hope to see you soon, and hope to be able to schedule another call with you then.
See you, Michał. Cheers to you, man.
Thank you.